My name is Hitendra Patel. I am the lead physician at Wellstar Pulmonary Medicine and the medical director of the Wellstar Sleep Program. I first learned about the WatchPat through the cardiovascular medicine colleagues at our system here at Wellstar. They had expressed an interest about using that home sleep testing device in their AFib patients, particularly because they had recognized the relationship between obstructive sleep apnea and atrial fibrillation. So there is a growing awareness of sleep apnea being an important clinical condition beyond the bread and butter physicians, which would be myself, a sleep physician, pulmonary physicians, ENTs, surgeons who treat the disorder surgically. Most primary care physicians are very well versed in it. It's taught in medical schools now, it's on their curricula. But also the other specialties, particularly to cardiology, for example, because there's a huge overlap with a lot of the cardiac conditions. There's more and more evidence and research that suggests untreated sleep apnea is almost like having untreated high blood pressure or untreated diabetes as a cardiac risk factor. So that's the way I present it to my patients. The patients who come to see me for an evaluation, they have trepidation at different levels. Firstly, getting the test in a sleep lab is a weird place. They're wired up to the wazoo with all sorts of monitoring and equipment, but then the treatment part as well. At least on the diagnostic side, getting them a WatchPat home sleep test is a peace of mind for them, because I explained to them, you don't have to worry about any bands you have to put across your chest or anything on your forehead. It's a simple watch-like device, watch strap with one pulse ox type device that extends from there onto your finger. Most patients are familiar with getting a pulse ox measurement checked. And then there's the optional single lead that attaches to the chest for measuring snoring and body position, and also now the central events as well with the thoracic movement as well. So it is, in terms of ease of use, when it's described to the patient, they are very thrilled to hear about that. With WatchPat, we have a much greater degree of reliability, of correlation with an in-lab study. So there is very little that can go wrong with the strap coming on for something like that, compared to the other options of doing home sleep studies. The other models all require some form of bands across the chest or abdomen, flow sensors across the nose, things that can slip, move, and then your night's testing or your signal is going to be invalid. I have patients who tell me that their experience couldn't have been easier. So it's a relief for them, absolute relief.